What is PCO, polycystic ovaries? Ever since you were 15, you've experienced irregular periods, stubborn acne, hair loss, and unexplained weight gain. Now, at the age of 26, after months and months of failed attempts to fall pregnant, you visit your doctor in a state of panic to find out what's wrong. Hello, and welcome to MedTouch, the best place to find the right medical information. Irregular periods, weight gain, acne, hair loss, fertility issues. These are just some of the many frustrating symptoms associated with a hormonal reproductive disorder known as polycystic ovary syndrome, or as it's commonly referred to as PCOS. If you've never heard of polycystic ovary syndrome before, don't worry, you're not alone. PCOS affects up to 13% of women of childbearing age, and it's the leading cause of female infertility worldwide. Yet many people still remain unaware that the condition even exists. What's even more concerning is that it's estimated that up to 70% of women with PCOS develop the condition during early adolescence, but they don't actually know they have the condition until they reach their late 20s or early 30s, when they start having trouble falling pregnant, or worse, when they start experiencing serious health complications. Not receiving a proper diagnosis or receiving a diagnosis later in life can be extremely problematic for numerous reasons, but we'll get back to that later in the video. But for now, let's start off with what polycystic ovary syndrome actually is. In short, PCOS is a complex group of symptoms that cause hormonal irregularities in the form of irregular or absent menstrual cycles, excess levels of male sex hormones, and in some cases, enlarged ovaries with multiple small fluid-filled cysts or follicles. In a healthy ovary, these follicles are used for preparation and release of eggs, and only a few of these follicles can be seen at a time. In PCOS, however, women have a much larger amount of these follicles, or cysts, hence the name polycystic ovary syndrome, which are partially grown to maturity and fail to release eggs regularly. Causes. So, what causes PCOS? Well, the truth is, we don't have a clear answer just yet, but researchers suggest that several factors are likely at play. The most prominent factor appears to be genetics. If you have a mother, sister, grandmother, or aunt with PCOS, you have a 50% chance of being diagnosed with the condition yourself. Also, you're more likely to develop the condition if you're a woman of Asian, African, and Aboriginal and Torres Strait Islander background. One of the strongest theories is that the external wall of ovaries in people suffering from PCOS is much thicker and stronger than usual. Therefore, at the mid-menstrual cycle, the release of eggs from follicles to outside of the ovaries becomes impossible, which causes extra hormonal secretion and, as a result, hormonal imbalances. There's also a strong connection between PCOS and insulin resistance. Insulin is the hormone produced in the pancreas that allows your cells to uptake sugar from your bloodstream. Research studies have shown that many women with PCOS have reduced sensitivity to insulin, which can result in weight gain and a predisposition to diabetes. Excess androgens, also known as male hormones, are also found to interfere with fertility and ovulation by preventing an egg from maturing and being released as it would during a normal period cycle. An excess of androgens generally results in physical symptoms such as hair loss, acne, or excess facial and body hair. The last factor is weight gain and obesity. Gaining a large amount of weight often results in excess inflammation, excess insulin levels, and excess androgen levels, which in turn can interact with your genes and contribute to the development of PCOS. Symptoms. So, how do you know if you have PCOS? Well, there's no single test to determine whether you have the condition or not. To know for sure, you'll need to visit your doctor. Your doctor will gather information on your medical history, as well as perform a series of tests, including a blood test, pelvic exam, and in most cases, a pelvic ultrasound. Generally, women present with a variety of symptoms, including irregular or absent periods. For example, fewer than 9 periods a year, prolonged or abnormally heavy periods, or no period at all. Excess facial and body hair known as hirsutism, thinning or balding scalp hair. Severe acne, darkened skin around the neck, armpits, or breasts, a common sign of insulin resistance. Difficulties in becoming pregnant, anxiety and depression, weight gain, obesity, or difficulty maintaining a normal weight. Sleep disturbances, pelvic pain or bleeding, fatigue, headaches, high blood pressure, high cholesterol levels, and high blood sugar levels, also known as diabetes mellitus. When consulting with your health professional, it's important to be as honest as you can about your presenting symptoms. Complications. Now, as we mentioned earlier, living with PCOS and not receiving a diagnosis or even receiving a diagnosis later in life can be dangerous for many reasons. This is because PCOS is associated with an increased risk of several serious and potentially life-threatening health conditions. For example, recent studies have found that women with uncontrolled PCOS will be at greater risk of developing type 2 diabetes or pre-diabetes before the age of 40. High blood pressure and high levels of bad cholesterol, resulting in an increased risk of heart attack or stroke. Sleep disorders such as insomnia and obstructive sleep apnea. Mental health conditions including anxiety, depression and eating disorders, and endometrial cancer. Management. Unfortunately, there's no cure for PCOS, but luckily there are several ways to treat and manage the condition long term. You and your doctor will work together on a treatment plan focused on managing your individual concerns such as infertility, excess hair growth, acne, or obesity. Generally, lifestyle changes such as eating healthy, exercising, and losing weight are the most effective ways to manage symptoms of PCOS. In fact, if you're overweight, losing just 5 to 10% of your total body weight can help to lower your blood glucose levels, reduce insulin resistance, balance hormone levels, assist with regulating and improving your menstrual cycle, and increase your chance of falling pregnant. Weight loss can also be very effective at preventing many of the health conditions associated with PCOS, such as high blood pressure, cardiovascular disease, and diabetes. For many women, weight loss and lifestyle changes are all that's needed to stay healthy and manage their symptoms long term. However, for many others, medical treatments may be required. For women who wish to avoid pregnancy, a doctor may prescribe birth control pills to help normalize and regulate menstrual cycles, as well as reduce levels of male sex hormones that cause symptoms such as excess hair growth, acne, and hair loss. Birth control pills can also help to lower the risk of endometrial cancer. On the other hand, if you're trying to fall pregnant, your doctor may also prescribe you with medications to help induce ovulation. Insulin sensitizing drugs, which are usually used in diabetes, are also commonly prescribed. These medications have shown to be effective for women with PCOS by helping the body respond to insulin more readily, as well as better control blood glucose levels. They can also help to reduce androgen levels, which as a bonus may help take care of acne, excess hair growth, and hair loss. Lastly, antidepressant medications used in conjunction with therapy may be helpful for those who experience symptoms of depression, anxiety, and low mood. If you suspect that you may be suffering from PCOS, make an appointment with your GP as soon as possible. The sooner you receive a diagnosis, the sooner you can access support and treatment options to help you stay healthy and well whilst living with your condition. If you'd like more helpful information and tips, be sure to check out our channel. We have a range of videos on many different topics such as weight loss, managing diabetes, lowering high blood pressure, and managing depression and anxiety. So be sure to check them out. Thank you for watching. Be sure to like this video, subscribe, leave us a comment, and turn on that notification bell so we can stay in touch.